What is enteral feeding? Enteral feeding refers to intake of food via the gastrointestinal (GI) tract. The GI tract is composed of the mouth, esophagus, stomach, and intestines. Enteral feeding may mean nutrition taken through the mouth or through a tube that goes directly to the stomach or small intestine. In the medical setting, the term enteral feeding is most often used to mean tube feeding. A person on enteral feeds usually has a condition or injury that prevents eating a regular diet by mouth. But their GI tract is still able to function. Being fed through a tube allows them to receive nutrition and keep their GI tract working. Enteral feeding may make up their entire caloric intake or may be used as a supplement. When is enteral feeding used? Tube feedings may become necessary when you can't eat enough calories to meet your nutritional needs. This may occur if you physically can't eat safely, or if your caloric requirements are increased beyond your ability to eat. If you can't eat enough, you're at risk for malnourishment, weight loss, and very serious health issues. This may happen for a variety of reasons. Some of the more common underlying reasons for enteral feeding include a stroke, which may impair ability to swallow, cancer, which may cause fatigue, nausea, and vomiting that make it difficult to eat, critical illness or injury, which reduces energy or ability to eat, failure to thrive or inability to eat in young children or infants, serious illness, which places the body in a state of stress, making it difficult to take in enough nutrients, neurological or movement disorders that increase caloric requirements while making it more difficult to eat, GI dysfunction or disease, although this may require intravenous, nutrition instead. Types of enteral feeding. According to the American College of Gastroenterology, there are 6 main types of feeding tubes. These tubes may have further subtypes depending on exactly where they end in the stomach or intestines. The placement of the tube will be chosen by a doctor based on what size tube is needed, how long enteral feeds will be required, and your digestive abilities. A medical professional will also choose an enteral formula to be used based on tube placement, digestive abilities, and nutritional needs. The main types of enteral feeding tubes include nasogastric tube, NGT, starts in the nose and ends in the stomach; orogastric tube, OGT, starts in the mouth and ends in the stomach. Nasoenteric tube starts in the nose and ends in the intestines. Subtypes include nasojejunal and nasoduodenal tubes. Oroenteric tube starts in the mouth and ends in the intestines. Gastrostomy tube is placed through the skin of the abdomen straight to the stomach. Subtypes include PG, PRG, and button tubes. Jejunostomy tube is placed through the skin of the abdomen straight into the intestines. Subtypes include PJ and PRJ tubes. Procedure for placing the tube, NGT or OGT, placement of a nasogastric tube or orogastric tube, while uncomfortable, is fairly straightforward and painless. Anesthesia isn't required. Typically a nurse will measure the length of the tube, lubricate the tip, place the tube in your nose or mouth and advance until the tube is in the stomach. The tube is usually secured to your skin using soft tape. The nurse or doctor will then pull some gastric juice out of the tube using a syringe. They'll check the pH, acidity, of the liquid to confirm that the tube is in the stomach. In some cases, a chest X-ray may be needed to confirm placement. Once placement is confirmed, the tube may be used immediately. Nasoenteric or oroenteric tubes that end in the intestines often require endoscopic placement. This means using a thin tube called an endoscope, which has a tiny camera on the end, to place the feeding tube. The person placing the tube will be able to see where they're putting it via the camera on the endoscope.